Hey guys, this is Dr. Hub. Today we look at the treatment of malaria. So let's look at treating malaria. So first is the Plasmodium vivax, P. vivax, malaria, Plasmodium vivax, malaria. So in terms of this, what is a DOC? DOC means the drug of choice. Then Plasmodium vivax malaria, the DOC is nothing but the chloroquine. So this chloroquine is 25 mg per kg. So this can be divided into three. That is, you have the 10 mg per kg, and this is on day 1. Next is there is 10 mg per kg, and this will be on day 2. And then comes the 5 mg per kg. This will be day 3. So what about the primaquine dose? The primaquine dose will be about 0.25 mg per kg, and this is for the 14 days. Next, this is for the Plasmodium vivax. Then comes we look at the Plasmodium falciparum. The Plasmodium falciparum. So in terms of the Plasmodium falciparum malaria, so this is mainly found in the northeast states. And what is the drug of choice? The drug of choice is the ACT. So ACT-AL. So ACT-AL, it stands for the artemisinin based combination therapy as well as artemether-lumefantrine. Let's write it down. So it is a artemisinin based combination therapy. Next, it also includes the artemether-lumefantrine. It includes the artemether-lumefantrine. So then it also includes this will be for the ACT and AL will be for 3 days. So this is going to be for 3 days. Then comes the ACT-SP. There is ACT as well as SP. So it occurs when? So this occurs for 3 days. So this will occur for 3 days. And let's look at the primaquine dose. The primaquine dose will be 0.75. This is per kg. And this is on day 2. And next is the ACT-SP for 3 days. This will be for the primaquine dose will be 0.75 mg per kg, and this is again on day 2. Next, we are going to see mixed infection. So what happens in case of mixed infection? So here there is we are going to look at the northeast and other states. So to begin with, in here we have ACT-AL. So we have discussed it is the artemisinin based combination therapy, as well as the AL for the artemether-lumefantrine. So it is artemether-lumefantrine. So let's look at the dose. So this is one, and next one will be ACT-SP. So SP, this is for 3 days. So what is meant by ACT-SP? So SP, it can include, it refers to the sulfadoxine. It is sulfadoxine and pyrimethamine. It is sulfadoxine and the pyrimethamine. So this will again be for 3 days. So let's look at the primaquine dose for this. Primaquine dose is nothing but 0.75. It is 0.25. It is 0.25 mg per kg, and this will be for the 14 days. The next, for the ACT-SP, it is again going to be 0.25 mg per kg. This is for 14 days. So in falciparum malaria also it was very similar for 3 days and 3 days, but it is 0.75. Next we look at the resistance to the ACT. So there is resistance, and this is to the ACT as well as the severe malaria. ACT and the severe malaria. So what does this include? So the DOC here is nothing but there is quinine. Then we have the pregnancy in case of pregnancy as well as the P-Vivax. So here the DOC is going to be the chloroquine. So it is nothing but the chloroquine. And what about the primaquine dose? The primaquine dose here, it is totally contraindicated. Then we move on to the pregnancy as well as the Plasmodium falciparum. So here what's happening is, in case of the first trimester, it is quinine, and in case of the second and third trimester, it is the area which is specific, ACT, and in case of primaquine dose, it is contraindicated. So this was all about the treatment in case of the malaria. To learn and grow daily like this, please do subscribe.